Hello, everybody. Welcome. Happy Thursday. Thank you so much for joining us today. I'm Hillary Romke. I'm the program manager for the foundation. Today, we are going to be talking about integrative medicine. We're going to be discussing cannabis use and mindfulness in cutaneous lymphoma. So I would just like to thank our corporate partners and our individual donors. Thank you for making these programs possible. We're really grateful for you, and without you, we couldn't do these, so thank you. So today we have two wonderful folks joining us today. We have Dr. Mishi Shinohara. Hi, Dr. Shinohara. How are you today? I think she's on mute, so we'll unmute when it's time for her
Thank you.
presentation. Dr. Shinohara is with the University of Washington, and she is also a member of our Research Advisory Council. And joining us here in a little bit, we also have Erin Kopp. Erin is an acute care nurse practitioner with the City of Hope National Medical Center. So what we're going to do is we're going to start out today. I'm going to stop sharing my screen and let Dr. Shinohara share hers. And she will start us out today discussing cannabis use with cutaneous lymphoma. So I'm going to turn it over to you, and I will mute myself, and then we'll shift over to Erin after you're done. And if everybody would just not mind saving their questions till the end, there is a Q&A bar at the bottom of your screen, and you can submit questions during the show, and then we will answer all of them at the end. So I will turn it over to you. Thank you so much.
Thank you. Thank you so much for inviting me. I'm really excited to be here. And so I'm going to talk today about cannabis, but also a little more broadly about integrative medicine and cutaneous lymphoma. And I have a few disclosures. The first is that I am a clinical investigator for several trials for cutaneous lymphoma. The biggest disclosure is that this work was not funded, and also I'm not a cannabis expert. So I fell into this realm kind of similar to how I fell into learning all about Pokemon. I have a 6-year-old. When someone important to me cares a lot about something, I want to go learn about it so that I can speak the same language and be helpful. And so in this case, it's my patients, obviously in the Pokemon, that's my son. Also, I am not personally a cannabis user, but I did grow up in Alaska and it was legal then, so have had some exposure. So we're going to be talking broadly about health-related quality of life. And when we talk about what is health, I love this definition of it. This is from the WHO, World Health Organization, which really has a broad definition of health that goes beyond the absence of disease. It's a state of complete physical, mental, social well-being. And I think that's really important to frame this on, that we shouldn't just be shooting for not having disease, we should be shooting for thriving. The concept of integrative medicine is not new, but I think we're talking about it more now. And I think integrative medicine has come into play more because as our medical knowledge and longevity has advanced, it's really become clear that living longer isn't always living better. Integrative medicine can be anything that is speaking to any component of your physical self, your spiritual self, your mental self. And really it's grounded in the patient, with the patient in the center. So it's a combination of allopathic, traditional, what we used to call complementary medicine, prayer, all those things can play into integrative medicine. So we did a survey of the Cutaneous Lymphoma Foundation via the Facebook and listservs, and thank you very much for those who answered and to anyone who looked at it. This was last year, pre-COVID, and we had just about 300 responses, which was awesome. And we asked, who is using integrative medicine right now? And we found that almost 60% of people with cutaneous lymphoma reported using some type of integrative medicine. And what we thought was really interesting was that 48% of that 59% said that they were using these integrative medicine modalities to actually treat their lymphoma. It wasn't just to treat symptoms, which is what I assumed would be the majority. It was actually the reverse. And what were people using? Vitamins and minerals were the most common. About a third of people who were using integrative medicine reported that. Prayer and meditation were also common, different diets, exercise and yoga, and marijuana. Other things that people reported included massage, homeopathy, acupuncture, traditional Chinese medicine. So we're going to talk some more about cannabis in a minute, but I did want to point out that what we found in this study, and it's currently been submitted for publication, so stay tuned about that, but that we found that those who reported using integrative medicine modalities also reported worse health-related quality of life. And on the surface, you might think, so integrative medicine makes your quality of life worse, but I don't think that's the case. I think what it is that people who are suffering more are searching for other ways to help relieve their suffering. People who had worse quality of life also tended to have more depression, anxiety, and so you can also ask chicken and egg about that. But my take-home message about this is that we know that people in our group anyway were suffering, and that we aren't doing a good job addressing all of the symptoms, and we want to do better at that. So let's talk about cannabis. So just a brief timeline about cannabis. First, legalized for medical use in the mid-90s, and really started in California with Proposition 215, but then spread kind of across the West Coast. In 2012, Washington and Colorado, kind of almost the same time, legalized recreational marijuana. And then 2019, there's nothing major happened, but there are some moves towards decriminalizing marijuana on the federal level, because importantly, even though marijuana, we're talking about that in cannabis products broadly, it's still illegal on the federal level. So around 2012, really started to hear a lot of this kind of question. My itching is making me crazy. I'm having pain. What do you think about? And I said, I'm not really sure. So I went and did some research. Now we know marijuana is legal for either medical or recreational use in many, many states across the country. So this is definitely something we as providers are encountering, and you as patients may be using. There are several reasons why people might turn to cannabis product in the setting of cancer. The first that we encounter a lot is for chronic pain. There's actually literature that it's helpful as an anti-seizure medication. Also some studies about using cannabis products for cancer-related nausea and vomiting, and as an appetite stimulant. And I'll refer you to this website, the National Center for Complementary and Integrative Health. They have really a nice list of all the different studies that have been referenced. And I'll also say that in our own system in Seattle, at the Seattle Cancer Care Alliance, there was a study done of everyone who walked in the door over a period of time by Dr. Pergam, who's one of our infectious disease colleagues, and he found that 21% of people who walked into our cancer center had used cannabis in the past month. So it's very clear people are using it. And how about for cutaneous lymphoma? We actually surveyed our group specifically around that after seeing our previous data, and 120 people responded to that. And thank you, especially to the people who did both. I really appreciate that. Similar to the larger cancer data that people have found at the Seattle Cancer Care Alliance, 22% of patients with cutaneous lymphoma reported currently using cannabis, and about half of those people said that they started using it after their diagnosis of their cutaneous lymphoma. The reasons that people listed for using it were to alleviate anxiety, pain, stress, itching. I think itching's a big one. And really importantly, people were very interested in learning more about it. When we asked them 1 to 10 how interested, 7.5 out of 10, and they wanted to hear it from their doctor. They didn't want to go on the internet and learn about it. They didn't want to learn about it from their friend down the street. They want us to learn about it and tell you. Okay, so let's talk a little bit more about cannabis. Cannabis, there's several different families of plants in the cannabis genus, and sativa is one of the most common, but not the only one. And there are different types of cannabis sativa, including plants that we know commonly as marijuana, which is higher in THC, and ones that we know more as hemp, which are a little bit higher in other compounds. The active ingredients in cannabis, what is medically active, are phytocannabinoids, and these are products that are kind of specific to cannabis. And the one we're most familiar with is THC, tetrahydrocannabinol. But also cannabidiol, CBD, is quite prevalent. And there are, like I said, 120, but a short list of ones that people are really aware of. So there's a lot in there that we're not super sure about. So when thinking about what is the specific data about cannabis, and in the medical arena, we like to go to our studies. We like to say, like, well, what % of people got X improvement with this? And I'll just say from the get-go that there are really significant barriers to that kind of research for cannabis and cannabinoids. And the reason is because it's still illegal on the federal level. It is a Schedule I substance, which is on the same level as heroin and amphetamines, and has a lot of restrictions. And so in order for someone to do research around this with actual cannabis products, they have to jump through a lot of hoops. The other thing is, as far as I understand, there is a single source of cannabis in the US that's allowable to use for research, grown at the University of Mississippi. And my understanding is that what's grown there is much lower potency than what people are actually using. So the studies may not even be sort of on par with what reality is about what people are experiencing. So there's a lot more use than there is data. So kind of take that for what it is. How do cannabis products work in our body? So we have our own internal system of receptors for cannabis, and it's called the endocannabinoid system. So we ingest cannabis products however we ingest them, and they bind to these receptors and they act in various ways. And I'm showing the brain because what we're most familiar with is THC and its activity as a psychoactive compound. But it turns out that there are cannabinoid receptors all throughout the body, including in the skin. And so that piques interest about what else could these cannabis products do in our body. And this is a photograph of a slide of the skin, and just to know that those receptors for cannabis products are actually located in the surface of the skin, in the epidermis, in the sweat ducts, also the oil glands, and also in nerve twigs, blood vessels. So they're definitely found in the skin. In what evidence do we have that cannabis and cannabinoids are effective for cancer? The best evidence is for certain types of brain cancer. There's actually clinical trials showing increased survival with a particular type of cannabis extract called Sativex, which is available in Europe. There's some data in lung cancer, breast cancer, GI cancers like pancreatic and colon. But in most of these studies, besides the brain cancer, I'll say, the data is pretty mixed. So it might show some activity when you're in vitro, meaning in a petri dish, but then when products are used in people or in animal models, they don't show the same level of activity. Relevant to us in the cutaneous lymphoma world, we wonder about, well, what about what we call the liquid cancers? Things like myeloma, leukemia, lymphomas. There is some data for leukemia and myeloma, which is a little bit easier to study because you can take those out of someone's body and study them. And in this, certain cannabinoids have been shown to make cancer cells more susceptible to chemotherapy. So they sensitize to chemotherapy. How about CTCL? This is hot off the presses. There was a study done recently in vitro, which showed that high CBD containing cannabis extract, so it contains all of those phytocannabinoids, were active against both mycosis fungoides and Sézary cell lines. When they split it up into different parts, some that had higher THC, some that had higher CBD, they found that actually the THC by itself led to a slight increase in cancer cell growth. It was this combination of CBD and THC compounds that they weren't even actually able to fully characterize that led to killing of cancer cells. And it turns out that this was actually on par, the killing level was on par with some chemotherapy agents like doxorubicin. So that's pretty exciting, I think. And they also then took it out of the Petri dish, took a patient's cells from somebody who had Sézary syndrome and showed that same activity in the outside of that person's body. So with that knowledge, how do I cancel my patients? Like, what would I tell my patient who says, I'm really itchy, what do you think if I do this? I tell patients that I think that they might help with pain. They might help with insomnia. They might help with itching. I tell people right now, I don't know that I feel confident that cannabis products are active against their cancer, but I don't think it's crazy to think that they might be. I used to think it was crazy to think that. I don't anymore. I think it's really critical that whatever you're doing, that you keep your team informed. Like your team needs to know if you're using cannabis products. I also tell people, obviously adults only, don't let your children access these products. And really importantly, don't vape. There's very clear data that there are pulmonary disorders associated with vaping. And the reason that this ID doctor at the Seattle Cancer Care Alliance got involved with this study looking at cannabis was because they were seeing a higher incidence of lung infections in people who were vaping and smoking. The last thing is that you don't really know what's in there. And so, one product might not translate into another one. And so just keeping that in mind, if one works doesn't mean another will. So to sum up my section, we know that many of you with cutaneous lymphoma are using integrative medicine therapies, including cannabis, and a lot of you are interested in learning about it. Know that right now the research is limited, especially about cannabis, but there is some data supporting the use, even against the cancer itself. And I just encourage you to keep open communication with your team. And I think that's what I got.
Thank you so much, Mishi. I really appreciate it. We already have some questions here, but I think we're going to save those till the end, if that's still okay with you. And we will turn things over to Erin to discuss mindfulness with us. Hi, Erin. How are you?
Hi, how are you guys?
Good. Thank you so much for joining us.
No, thank you.
Cool. So I'm going to go ahead and have your slides pulled up here.
Okay.
There we go.
Right. So thank you for letting me join you today. I have been lucky enough to talk about mindfulness with CLF before, and I really feel like although we're talking about cutaneous lymphoma, the ask was really to talk about mindfulness and just finding peace in spite of life's challenges. And so when I talk to anybody who has any type of cancer, any types of chronic illness, and quite frankly, in the midst of the pandemic, we talk about how do you deal with the challenges that keep coming up. And so that's what we're going to focus on today. If I could have the next slide, please. So, stress is something that's difficult to quantify, right? We feel it, we know it. Sometimes we're not even aware that it's going on, but there are deleterious effects on both your physical and your mental health status. So stress by itself is a challenge. And when you're dealing with a chronic illness, it makes it even more difficult and can put some obstacles in your path in terms of acquiring treatment, responding to treatment. And stress reduction programs that are at systems level, it's like, oh, here, come to this group, or come, we're going to do this for the next 8 weeks, don't often address what are the strategies to just deal with what I'm feeling right now. If I'm at home and it's 2 a.m., or if you're like me in California and an earthquake woke you up today at 4:30, and then boom, your brain kicks in. How do you deal with that in the moment? And mindfulness has truly been shown to help acquire those skills that are necessary to address situations and mitigate many of the negative effects. Next slide, please. So, mindfulness, it sounds very much like, a novel thing, right? People say, I'm practicing mindfulness. I know in the last presentation, there was the mention of meditation, and some people think that they're synonymous, and they can be. But realistically, mindfulness is acknowledging that our brains in default mode, they tend to be in autopilot. So you're driving down the street, you've been driving down the same street for 10 years, going to your house, you're in autopilot, you're not focused. And then somebody rides out in front of you in a bike and boom, you slam on the brakes and suddenly your heart is pumping out of your chest and you're very focused. Because before, your brain can only take so many different inputs at a time. So it just checks out in default. And believe it or not, most of our waking hours are actually spent in a mode thinking about, right? I'm thinking about what I'm going to do when I go home. I'm thinking about what I want to eat for dinner. I'm thinking about these things instead of being present in the moment and not being here right now. And it seems counterintuitive when we're talking about stress. Why would I want to be more in tune with what I'm feeling right now if those feelings are bad? But we're going to talk about that in just a second. And ultimately, it's just a lack of attention. Next slide. So automaticity and reactivity are best friends. And you can see that very stressed person driving home, like I mentioned, you're on the freeway, people are honking at you, you're in that autopilot. And what happens is you react. And the problem with reacting is that you don't get a chance to have a moment to stop and think about what your response is going to be. So reacting and response, we can think of differently. When I am in the grocery store and somebody right now is standing 3 feet away from me instead of 6 feet and not wearing a mask, my reaction, if I was just in automatic mode, might be to yell, might be to be rude, might be to say things that are inappropriate because I'm anxious and I'm reacting. However, if I have that moment to stop and think and be present, even though I'm in an uncomfortable situation, I'm far more likely to respond in a fashion that actually has a constructive and a positive outcome. So next slide, please. So the question is, where does the mind go and who's in charge? And it's an interesting thing to think about. So it's like, well, it's my mind, so I'm in charge, but not necessarily. And mind wandering is an excellent predictor of people's happiness. But contrary to what you might think, if you look on the third bullet, a wandering mind is an unhappy mind. And when I first thought about a wandering mind, I thought, oh, you know, sitting on a beach somewhere and just not thinking about anything, looking at the ocean, letting my mind wander. That's a little bit different, but you're present in that happy moment. What happens when people's mind wanders and they leave the present, where they tend to go is really a better predictor of our happiness than what we're doing. So if I'm with my children, who I adore, and we're having an engaging conversation and we're coloring together and I'm present, I can enjoy that happiness. However, if I am dancing at a dance class, and I also love dancing, but while I'm at the class, I'm thinking about, oh my goodness, I have to get to work tomorrow. I have 5 meetings tomorrow. Oh, what about, I have to go to the doctor's. Am I taking my medication correctly? You are, even though you're engaging in a happy activity, you're not really having happiness. Next slide, please. So the question I ask everyone, is your mind full or are you mindful? So you're at the park with your pet, the beautiful trees are there, but do you see the trees? Or is your mind full of all of these other things, the driving, the appointments, even music, even happy things, but are you present or are you absent? Next slide. So what exactly is mindfulness? You know, there are many definitions, but Jon Kabat-Zinn is really the father of Western mindfulness. And he says that it's paying attention on purpose. So I just want to break it down. I'm paying attention to what's going on because I'm trying to pay attention in this present moment. And the biggest thing is non-judgmentally to the unfolding experience moment to moment. So I want you to picture you're at the doctor's office and you just got news about how you're responding to a medication. It's not the news that you want. And you've been feeling horrible. And so right now, if you pay attention, the emotions may be fear, anxiety, disappointment, questioning. And so if you are not judging that and just in the moment, not saying, why are you so questioning the doctor? Why can't you do a better job? All of those inner thoughts that judge ourselves, being mindful without that judgment and just being part of the experience moment to moment is what we're referring to. Next slide, please. So what is mindfulness not? Right? It's not a relaxation technique. I'm not going to be able to tell you one specific thing and you're going to suddenly have mindfulness. It's really not about having a particular kind of experience. You know, you go to a yoga class and you think, oh, I'm supposed to go and I'm be relaxed, or I'm supposed to be energized, or I'm supposed to be. You're not supposed to be anything with mindfulness. It's just what you are. And a big thing, it's not religiously affiliated. You know, mindfulness does have its tenets that are founded within Eastern religions. However, the concept of mindfulness has no religious affiliation. And it's not about absence of thought. If it was, I could have never practiced. To give you some background, I am a multitasker. I like to think a lot. I'm a mom of two. I'm a manager. I just finished my doctorate. I had a lot of things going on at the same time, and I never could get into meditation because I felt like I was failing because I couldn't clear my mind. But that's not what this is. And it's not easy, but it is simple. And the reason I say it's not easy is just that creating a habit, creating a pattern is not easy. So learning mindfulness is simple, but utilizing and practicing mindfulness is a little bit more challenging. And it really isn't about doing things slowly, right? You have a life. You have to keep going. You want to be able to enjoy. You want to be able to have a sense of urgency when you need to, but you also want to be able to be present. So doing things slowly is not the key here. Can I have the next slide, please? So some benefits of mindfulness awareness practice. There has been a lot of research done into mindfulness, and much of the research that I've done myself has been surrounding this. In California at UCLA, there is a center where they match neurobiologists and mindfulness practitioners, and they've been doing studies for over a decade to really see what's the benefit, both what we think, psychologically, emotionally, psychically, but also physically. So it's been present in history for over 2,500 years, and the beliefs were that it reduces stress, reduces chronic physical pain, boosting immune system, aid in coping with painful life events, enhancing those positive emotions, including happiness and compassion. And I want to say compassion for yourself, which is a big thing, and it can be one of the biggest barriers for individuals. Mindfulness has the capacity to change your own relationship with life. So you decide, I'm going to take over this automaticity and the reactivity components that are the default to my experiences. And I want to be able to have a say. So the mind may go places, but I'm going to work towards having an influence over that. And have the next slide. So mindfulness awareness practice can be two things. It can be formal. So you can bring your attention to a chosen focus. I'm going to focus on the floor. I'm going to focus on my breath. Noticing when you're distracted. Learning to practice, where did those 10 minutes go? I wasn't paying attention. I was watching this webinar. Now she's talking about something else. I was thinking about dinner, right? And then returning to that chosen focus and like being okay that, yeah, I didn't pay attention exactly, but I'm okay, I'm coming back. And that you're gentle and kind and non-judgmental, but you have some, just a matter of fact, I went away and now I'm back. The usual objects of attention are breath, and that's because breath is always with you. You know, if you're into integrative medicine and yoga and meditation, breath is the source of life. But breath is also something, you don't have to have headphones, you don't have to have your phone, you don't have to have anything because the breath is with you. Informal practice, it's the same idea. It's just about attending, being aware. So it's directed to the mundane events and experiences of life. When you walk through a garden, do you notice the flower that's in front of you? So paying attention to what you are doing while you're doing it and being fully aware. And now, honestly, I'll tell you, many people who are trying to break habits, so if we're talking about issues with weight or issues with working too much, eating, working, these are activities that you can be aware of. I'm going to teach you something called stop, and then you can even have a walking informal practice, which I'll mention. Next slide, please. So the benefits, I will tell you, I found mindfulness for myself because I have 2 chronic illnesses. I'm diabetic since I'm a type 1 diabetic, so since I'm a young adult, and then also have pretty significant asthma. And when I started dealing with these chronic illnesses, I found that I was challenged to use the coping mechanisms that I knew, and I was losing much of the joy that I had in my life. And it was attributed to these burden that I felt of these chronic illnesses that I had. So I was lucky enough to meet an individual who really slowly introduced me to mindfulness or mindful interventions. And I really did see these first benefits, the psychological. So eventually improved cognitive and attention skills, because I could have some influence over whether I was going to perseverate on the pain in my feet because I have diabetic neuropathy, or if I was going to focus on my kids. It really cultivated my capacity for self-regulation. In times like this, I want to make the individuals that I'm interacting while I'm at the hospital my focus. And unfortunately, COVID's not gone away. All of my own stressors have not gone away. And when there's another stressful situation that comes up, I have the capacity now to calm things down and really have control over what my responses will be. It has been effective in reducing stress, situational depression, situational anxiety, enhancing the skills for interpersonal relationships. If you're not barking at people, chances are you're having a better relationship with them. And it offers a reprieve from stress. It offers a reprieve from that constant bombardment of, I have more appointments, I don't like these side effects, I can't stand what's going on in the world. Next slide, please. So physiological, decreased heart rate and blood pressure, improved sleep, changed perception of pain, and I'll talk about this too, improved immune function. So if we're talking about a cancer that we need to rely on improved immune function, especially this is natural killer cells, this is an important area of research that is beyond this talk, but and then also increased activity in the portion of the brain that allows you to kind of quiet that ancestral voice that says you're scared, you're angry, and have some self-regulation. Next slide. So if you want to take back control, this is your chance to explore the benefits of mindfulness in your daily life. You can try techniques, allow yourself to stumble. There is no right way. That you cannot think that I'm going to take Tylenol and my headache will go away. This is really a practice and habituating it into a pattern. And so I'd like you to think of it, and I work with my patients in thinking of it as a prescription for long-term fortitude, having the strength to deal with what's put in front of you and self-healing and just being in the moment. Next slide. So some simple practice techniques. I want to encourage everybody just very quickly to find a posture that feels good for you. People, when I would go to classes, would tell me to sit up straight, cross my legs. That didn't feel great. So it's very nice to know in mindfulness, I don't have to do that. Sometimes it feels best to lay down. Sometimes it feels best to stand up. So one very simple practice, you're sitting in the waiting room, you're waiting to go in to see the doctor. You don't want to make any kind of, big motion. People are around you in the waiting room. All you have to do is use the breath as your anchor. Meaning, when you're breathing in, either focus on how the air feels going in and out of your nostrils, how it feels going in and out of your abdomen, or even in and out of your throat. And focusing on that for a simple 30 seconds will refocus you. And think that your body is a doorway to mindfulness. So if we could go to the next slide, the stop technique is very easy to use. If you're in the grocery store, if you're about to yell at somebody, if you are just feeling like the world is overwhelming, stop. Stop what you're doing. take a breath. That forces you to become conscious of what's going on. Then observe how you're feeling. Well, I'm feeling pretty frustrated right now. But I've taken a deep breath, I've become conscious of how I feel, and I'm aware in the moment. And then I can proceed with what I'm doing. And although this is simple, this is a technique that's been utilized in many different research interventions and actually been shown to allow people to really change their reaction. So if you're new to mindfulness, I highly recommend just trying this technique. Have the next slide, please. But if you're somebody who's more physical, a walking meditation or mindfulness practice is one that I would recommend. It literally involves, if I'm sitting in my office, standing up, closing your eyes, providing it's safe. Please don't put yourself at a fall risk. And just feeling what your foot feels like on the ground each time you step. Another wonderful exercise is with eating, is literally taking one piece. So let's say it's 3 o'clock, and for some reason snack attack hits me at 3 o'clock, and I have my crackers, or I have pretzels, or hopefully if I'm healthier, maybe some almonds. And instead of just mindfully, looking at my computer, doing work or social media, whatever it is that you do, taking one almond, placing it in your mouth, chewing it, and while you're chewing it, thinking about all the things it took to get that almond to you, right? Think about the grocery store you had to buy the almond at, and then the people who packaged the almonds, and then the individuals who were picking the almonds, and then the individuals who planted the seeds for the trees to have the almonds come to fruition. And this may seem silly, but what it does is it helps to remind you how important each step is in any of the things that we do, right? And now you're focusing on that, and that food is something that's important and something that's nourishing to your body. And just this exercise helps to clear some of the noise, that rushing stream that's always going on, and just focusing. And finally, one that's really effective, and you can giggle and you can doubt it, but I've practiced it quite frequently. Like I mentioned, I have pretty severe diabetic neuropathy, is picking a point if you're in pain. So let's say my feet hurt. Picking a point on your body that doesn't hurt. So I pick the tip of my nose because it's rare that the tip of your nose will hurt. So you focus on the pain. I think about those feet and I focus on the pain, and then I focus on my nose. A couple seconds each. There's no guideline. There's no mandated amount of time. Back and forth. And what you'll find is that if you try to ignore pain, your brain thinks about it more. And that impulse keeps coming. It's kind of like chocolate cake. You weren't thinking about chocolate cake, but the minute I told you you couldn't have chocolate cake, all your brain can focus on is the chocolate cake. So that pain's there. Your brain's going to notice it. But if you focus back and forth, the pain is actually mitigated. So for my patients that I do bone marrow biopsies on, I've utilized this with them, and also just anecdotally have had really good results. Next slide. So besides the physical, emotional distress is just a part of our lives, and with all of the different things that you see on the TV and all of these images that we cannot help but be bombarded with right now, anxiety, fear, anger, feeling overwhelmed is the norm. And so one technique is called the RAIN technique, is to recognize what you feel. All right, I feel this discomfort in my stomach and my chest feels a little bit odd. I recognize now that that's associated with when I'm anxious. And then I accept it. Okay, this is how I feel. But I'm going to investigate it. Well, what happened that brought this on? Was it that I was walking down the street and somebody walked past me and coughed? Was it that, I have a family member who was just diagnosed with something? Is it something going on with me? So I'm going to investigate. But the key thing, everybody, is that feeling I have is not me. It's a feeling. So I'm not identifying Erin is not the anxiety. Erin is experiencing anxiety because of all of these other things. And it really allows your brain to disconnect from thinking, I'm a depressed person, I'm an anxious person, I am a fearful person, and really thinking more about, I feel fear, I feel anxiety, I feel depression. I'm going to be aware, I'm going to investigate, and it will allow me to work on it. Next slide. So mindfulness, again, it's easy to learn, but it really takes practice to master. This is not published yet, but we did do a pilot study and were able to identify that resilience was actually improved in individuals who practiced a mindfulness intervention more frequently. It was not about how much time, it was simply how many days a week that they practiced. So, there are many benefits to being present in a non-judgmental place, less reactivity, less automaticity, and in a world where you have very little control over things, it allows you to have control over your own response. And the experience of the symptoms is just a combination of the physiologic manifestations and emotional attachment to experience. So learning to be mindful allows you to have an impact on this. So if we can build a habit, those habits can lead to change. Next slide. Here are some simple resources. Luckily right now, if you live, depending on the state you live in, Headspace has been offered at a discounted rate or for free. The Calm app has been also offered for discounted rates. And as a disclosure, I have no correlation with any of those companies, but I think it's just knowing yourself, knowing what you're apt to do, and then just sitting down to do it. And with that, thank you very much. And we are happy to answer any questions.
Thank you so much, Erin. I almost feel more relaxed just after your presentation. I'm going to just start calling you at random times during the day and say, Erin, help me relax, please. So thank you. I really appreciate it. It's really insightful. And I think all of us can use a little more mindfulness in our lives, especially right now. So
yeah,
we really appreciate it. It looks like we have a couple of questions for both of you. Erin, maybe we'll just start with yours since we're kind of transitioning out. This was kind of addressed, but I know people were asking questions as the presentation was going on, but it says, is mindfulness a Buddhist practice?
Yeah, so it's a good question to clarify. And as I mentioned, it's been around for 2,500 years. Mm-hmm. Is mindfulness practice within different faith systems, within different belief systems? Absolutely. But mindfulness that I just described to you is completely secular. It's a concept. It's something, and I added that Western medicine take on it, right? In Western medicine, we have to connect. We have to see some sort of correlation. There are changes at the level of the DNA that we see with telomerase that affect aging in DNA. There are changes that are seen in functional PET scans. There are, in functional MRI. So these practices that I just mentioned are not Buddhist practices. Mm-hmm. Will you find similar ones in many faiths, not just Buddhism? Yes.
Okay. Thank you for clarifying. And then the second question is, are there formal classes online? What is the best app to use that you would recommend?
Okay, so there are formal classes online, many more online now than there were before because of the state of the world. And so what I would do, depending on where your geographical location is to look up mindfulness classes. And they're offered in many different places. The Mark Center, and I put the resource up on the PowerPoint, I like it because, well, I'm a Bruin, I went to UCLA, so I'm a little bit biased, but that's where I found the most consistent classes that I've been exposed to. They have been utilized, they've been studied, and so you can ensure that it's consistent. And it's not just somebody random teaching class. Not that there's anything wrong with that, but there are also many books. So if you like to listen to Audible, you can get audiobooks. There are multiple apps, like I mentioned, 10% Happier, Calm, and Headspace are the top 3 that I can think of. If you are connected with an institution, I know that multiple institutions have their own mindfulness apps that are free to patients. So that's another good resource.
Cool. Please excuse my notifications here. Okay, it looks like those are the only mindfulness related questions that we have. We have 3
Okay.
for you as well, Mishi. The first one is, would a script for medical marijuana be written by my dermatologist? I don't smoke, but maybe it could be used in a different way.
So it depends on the state that you live in. Medical marijuana, in many states, you have to have a special training and license in order to prescribe. So I think it's something to bring up with them, but I would say most dermatologists, unless they're working in a cancer center, with cancer patients, are unlikely to prescribe. I wouldn't say that, universally, but I think it's a little less likely.
Okay. And the second one, there were 2 kind of together. Is there evidence to suggest that cannabis use can exacerbate or make worse cutaneous lymphoma? And then it was followed up by, sounds like there may be some evidence that primary THC cannabis may exacerbate CTCL. What about B cell?
So the study that I mentioned actually only looked at T-cell lymphomas. So I don't know about B-cell lymphomas, and I really couldn't find too much in general about that. The evidence, and I'll just clarify, like in people, we don't really know one way or the other. Like this is all kind of in the Petri dish situation, that there's conflicting evidence depending on the ratio of THC, CBD, and the different phytocannabinoids. But it's clear that not just one compound is active.
Okay. And then the last question, is it safer to ingest marijuana instead of smoking it?
I mean, I would say it's a hard question to answer in some ways, but I would say, the short answer is probably yes. And really just because like no physician likes the idea of smoking anything.
Mm-hmm.
There's just, it's not clean. There's stuff for your, the vaping especially is like really high heat and very bad for your lungs. So yes, I would say generally yes. Also, especially if you're immunosuppressed, if your immune system is low because you're on treatment with something, then your gut is always a safer way to encounter foreign things.
Mm-hmm.
And so generally, yes.
Okay, cool. So those are all the questions we had. Thank you both so much. We're so appreciative of your time, and thanks for spending part of your Thursday afternoon with us.
Well, thank you.
Thank you for having us.
Thank you so much. If you guys want to turn your cameras off, I'm going to run a quick poll here, and I don't want to make you stay on with us. Thank you so much. So if everybody wouldn't mind just filling out a little bit of feedback for us, we really take your responses seriously, and we appreciate any feedback that you have. And just while we're signing off here, I wanted to let you all know we do have a couple upcoming programs. August 18th at 6 o'clock Eastern Time, we'll be having a Facebook Live talking about nutrition. And then on August 28th at 8 o'clock Eastern Time in the morning, we'll be having a webinar talking specifically about primary cutaneous B-cell lymphoma, so CBCL. So thank you everybody again for spending your evening with us. We hope you found this webinar valuable, and we look forward to serving you again at our next program. So thank you so much. Have a great evening, everybody.